Remember the Black Death? The plague killed 75 to 200 million people, wiping out about 60% of Europe's entire population in the 14th century. Infectious diseases remain difficult to handle. However, modern technology has brought us close to eradicating polio, the second human disease in history that we will have stopped for good. Less than 3 decades ago, the disease was still rampant in 125 countries, crippling 1,000 children every day. Since then, the incidence of polio has decreased by 99%. How did the world manage that kind of progress? In 1988, the Global Polio Eradication Initiative was founded by the World Health Organization, UNICEF, the US Centers for Disease Control and Prevention, and Rotary International, and later joined by the Bill and Melinda Gates Foundation. They fight the disease by doing 2 essential things simultaneously: finding out where polio is occurring and protecting kids from it using vaccines. Because of the partnership, millions of doses of vaccines have reached children around the world. By testing stool samples from children with paralysis, a symptom of polio, the infection can be diagnosed and its origin pinpointed. Once an infection is located, as many children as possible receive extra vaccine doses to boost immunity. Data about cases, the size of the outbreak and population affected, and information on the vaccination program is then collected and shared with the whole partner network via a centralized global data platform called POLIS. Combining these massive amounts of valuable information and looking at it holistically has made tremendous advances possible. Joint research helped to develop new tools for better estimating population numbers. Knowing how much vaccine is needed for an area makes a great difference. Because only 1 in 200 people who carried the virus get sick, as total case numbers began to drop dramatically, it became increasingly important to track the infection by detecting the virus in sewage samples before it can lead to cases. Thanks to better data available rapidly, every new outbreak can now be responded to within about 72 hours. Meanwhile, global partnerships push forward new diagnostic tools, better childhood vaccines, and outbreak response strategies, making eradication more likely than ever before. It doesn't end there. The polio system, including reaching children in remote areas, supply chains, and surveillance measures, are used to support other health threats like Ebola, measles, and leading childhood killers such as pneumonia and severe diarrhea. Eradicating polio will be one of the greatest achievements in human history, making a positive impact on human health for generations to come.